Now, do people who typically have chronic sinusitis flare up with an acute case every now and again, or are they kind of the same?
Sure.
Are they always related, or can you just get a sinusitis and kind of be done with it?
Yeah, all the above.
Wow.
But people with chronic sinusitis certainly are more apt to develop acute sinusitis. I mean, they are more susceptible, so that is true. So that's why we want to deal with the chronic problems so they don't develop the acute sinusitis. If we get the chronic inflammation under control naturally, they shouldn't get the acute problems.
So you're getting the inflammation under control with natural medicine. How about treating any infection? You mentioned fungal, but what if it was, viral, bacterial with an acute situation? We
have many things we can use. Quite often we'll use things like echinacea and golden seal to treat sinusitis, if it's viral or bacterial, which is helpful in fighting those organisms. We also use colloidal silver. Colloidal silver, both taken orally, you can take it nasally as well, kills all types of organisms, from fungal to viral to bacterial. So, we have the tools to do that, and on rare occasions we use antibiotics, but it's not very often. I can't remember the last time we did that.
If you were just leave, your sinusitis alone, would your body eventually be able to get out of it if you had a chronic sinusitis, or would you just be suffering continually?
Most people would continue to suffer. Most people with chronic sinusitis, if you don't treat the offending or the trigger of the problem, it'll go on and on, which is a big problem. Because again, remember, when you have the chronic sinusitis, you're more apt to develop polyps in your sinus passageways, and then you have more problems.
So now let's step back a little bit and let's talk about some of these nasal sprays that you can use for sinusitis, just for pressure relief here. You mentioned the one for fungus. Are there any other nasal sprays that people can use naturally to help with some relief?
Well, I wouldn't say the natural nasal sprays are great for pressure relief. They help pressure relief because they help fight the infection, which is triggering the inflammation and the pressure to begin with. There are herbs people can take, you can get in the health food store, which do help to decongest the sinus. Often a lot of the herbal teas for sinus have herbs in them which naturally decongest the sinus. There's some very good herbs in Chinese medicine, like Pueraria, used to drain the sinus and relieve pressure. So there are things we can use for that.
Now let's back up a little bit to homeopathy. If someone is having problems with herbs, environmental, they don't want to take herbs and things, can they use homeopathy?
Yes, we do use homeopathic remedies, which are dilute amounts, usually of plant or mineral substances. For sinusitis, they work very good for both acute and chronic. We use those a lot, especially for people that are very sensitive to taking herbs or medications.
Now, if they can't take quercetin, is there another, antioxidant that can be used to help with inflammation?
Yeah, another one that's commonly used is bromelain extract, which is a type of pineapple stem extract, and that is a nice natural anti-inflammatory for the sinus.
Now, if you take bromelain before your meal, though, it's going to help as a digestive enzyme.
Helps break down proteins, so that is a good point for sinusitis. So you would have to take the bromelain between meals to get that anti-inflammatory effect for your sinus.
And typically, how long does it take when you see a patient suffering from chronic sinusitis? Typically, how long does it take for them to find some relief?
Oh, we can have these people feel better within a matter of days with the natural treatment. As far as not really having any symptoms at all, usually anywhere between 4 to 8 weeks. The symptoms are quite limited with good natural treatment, but you certainly can help patients in a matter of just a few days of getting relief of their chronic sinusitis.
And then do they have to continue to take like the quercetin or some pro-immune herbs to help their body?
Well, it just depends. If you're treating the root cause of the problem, not necessarily. In other words, if you treat the fungal problem, they may not need ongoing treatment after you're done your protocol with that. If you treat the allergies properly, they don't necessarily need to keep taking things on a regular basis. So it just depends if you treat the root cause effectively or not.
So then with an acute sinusitis case, you can get them over the infection and then treat the cause of why they continue to
they're susceptible, exactly.
And that can happen. Now for children, same thing?
Absolutely.
That's excellent news. Great. Any other little tidbits you want to give our audience about sinusitis?
Well, just the thing with sinusitis is, in my opinion, the regular treatment that people get is not a good long-term treatment because usually it involves taking medications orally, which always can have side effects. Sometimes things like drowsiness, for example, dizziness, losing balance.
And that's with the conventional, even over-the-counter.
Antihistamines, allergy medicines, nasal sprays, like I said, they can have side effects like fungal overgrowth in the sinus. So Well, these things are sometimes used, you know, for really serious acute sinusitis. They're just not great long-term treatments. That's where the natural treatments really shine in comparison.